allowable. So we have to change this reality. We will work closely with the community to do it, but we have to change this reality. Commissioner?
Yeah, Mr. Mayor, I think you hit the nail on the head. Before we get into the specifics of yesterday's incident, what troubles me most is, as a department, as a city, we've been through a lot already. And members that have gotten sick, members that have given their life, whether it's in the health field, certainly in the police department. Make no mistake, this large gathering such as this is putting members of my department at risk. And it cannot happen, and it will not happen. And it's going to be met with very stern, as it was last night, immediately being broken up and stern consequences. What we know about yesterday's incident was at approximately 3:30 in the afternoon, we learned of the passing, unfortunately, of a prominent rabbi from the Williamsburg section of Brooklyn. Immediately, within minutes, members of the local precinct were in contact with clergy liaisons and members of the Jewish community in terms of what to expect at that location. Plans were put in place, a detail was put in place. Unfortunately, when you look back at some of the past incidents, there's been a lot of work done throughout New York City with every faith. And people, again, have been overwhelmingly compliant. But there has been a couple incidents that were not so. So contingency plans were put into place. A number of officers were detailed in the unlikely event that large numbers came, and we thought that that was a possibility, but absolutely, I think we've been pretty consistent, Mr. Mayor, for what seems like a longer time, but probably months now, that there are to be no gatherings in New York City, such as what we saw last night. So within, as the time unfolded last night, there was probably several thousand people that came in and around that location on Bedford Avenue. Additional officers, I was in conversations with members of the upper echelon of the NYPD. Additional officers were called in, and in pretty short time, that crowd was dispersed. And a number, I think the final tally I saw was 12 summonses were issued for a variety of offenses, certainly social distancing, and then including some for a refusal to disperse. But I want to end where I started with this. What happened last night simply cannot happen. And we need all New Yorkers have come together during this crisis, but they need to do it more than ever. And we need community leaders to stand beside us. We cannot have people unnecessarily being exposed to a disease that is having catastrophic effects on our membership and really New Yorkers as a whole.
Next, we have Henry from Bloomberg.
Mr. Mayor, good morning. My question has to do with how you are going to assess the different levels of risk involved in human activity. For example, why can't people play tennis? Why can't you regulate the amount of people who will be visiting or who could visit city pools when it's 98 degrees in the summer, or regulate the traffic going into city beaches and give people maybe a ticket or a rain check for another date if they can't go to the pool that day, and regulate the time period and the amount of use at that pool? Because we're facing what happened last night is almost like a release of a valve. There's going to be a level of frustration in this city that will be very difficult, I think. Maybe I'm wrong, but it'll be very difficult to manage the expectations and the needs of this population. I mean, am I wrong? What is your response to my question?
Well, Henry, I think you said a couple of different things. I think the issues you raised obviously are being felt all over New York City. But again, I want to say a large gathering, this is a different issue. When you talk about pools or beaches or tennis, you're talking about what individuals do. What we saw last night was absolutely unacceptable, and would be unacceptable in any and all communities. was a large gathering. Again, tragically, thousands of people. The amount of danger created by that kind of gathering is inestimable. The fact that people will die because of it, which goes against everyone's values. I want to separate that kind of thing from the question you're asking, which I think is a fair and important question about what can we do for everyday people, individual people from all parts of our community as we try to, over time, work our way back to normal. So I'd say the first rule is there will be no large gatherings of any kind anywhere. And anyone who equates a small number of people around, a blanket in a park with what we saw last night is entirely missing the point. We are talking about thousands of people in close proximity in one site. We will never, ever allow something like that to go unchecked anywhere. Now, if you say, okay, people are understandably yearning to get outside and the weather's going to get warm, we're working on this all the time, and we're going to have announcements on this soon, how we're going to address the warm weather. We've worked with the City Council on one piece of it, which is to try and open up more space in certain key areas with enforcement. But when you talk about pools, beaches, tennis courts, each thing's going to be looked at individually. There's the whole different piece of the equation, which we've talked about, which is what can we afford to open, and that's going to be all about what happens with the stimulus in Washington, whether we even have money to open some of these things, and that's a big question mark right now. But then beyond is the question of what will keep people safe, the most important question. What will protect people's health and safety? And places where a lot of people might congregate create a real danger. We have to know we can manage them properly, and there can be proper enforcement, and that the time is right. So the indicators will tell us when we can start opening up, and we're going to do it very carefully, methodically, and each thing you mentioned will be looked at in turn when the time is right, but only when the time is right.
Next, we have Marcia from CBS.
Good morning, Mr. Mayor. How are you doing today?
Good morning, Marcia. How are you?
I need to ask you about what happened in Williamsburg, because a number of leaders in the Jewish community are quite upset that the members of that community were singled out when there's been violations of social distancing in many places. Number one, they're asking for an apology. And number two, they're inferring that the fact that you're singling out a Jewish community could add to the number of anti-Semitic incidents that happen in the city. So I'm wondering if you will apologize if you feel bad about singling them out. Also related to social distancing, wondering if the NYPD will repurpose some staff like crossing guards who are not being used to help with social distancing. And on an unrelated topic about medical examiners, are you thinking about the possibility of directing the medical examiners to extend the hours on weekdays, maybe to midnight, and possibly staying open on weekends?
Okay. Marcia, respect all those questions. Our team will follow up with you on the medical examiner because, again, I'm asking everyone in the interest of fairness. All your colleagues have been doing 2 questions up front, 1 or 2, and we're going to stick to that rule. So I will speak to your question, and the commissioner can speak to the crossing guard question. I spoke last night out of passion. I could not believe my eyes, Marcia. It was deeply, deeply distressing. Again, this is a community I love. This is a community I have spent a lot of time working with closely. And if you saw anger and frustration, you're right. I spoke out of real distress that people's lives were in danger before my eyes, and I was not going to tolerate it. So I regret if the way I said it in any way gave people a feeling of being treated the wrong way. That was not my intention. It was said with love, but it was tough love. It was anger and frustration. What I saw, no, Marcia, it's not happened other places. Let's be honest. This kind of gathering has happened in only a few places, and it cannot continue. It's endangering the lives of people in the community. So to all those, and I understand politicians, everyone has said, oh, look, you know, this is like people gathering in the park. No, it's not like people gathering in the park. It was thousands of people. Can we just have an honest conversation here? It was not acceptable. We will not tolerate it. I also will not tolerate any anti-Semitism, ever. And for decades, I've made it my business to stand up for the Jewish community, and people know that. Won't tolerate anti-Semitism, won't allow it to grow in the city. We've fought it back many times. My message was to all communities, and that was written in black and white. But it was also to be clear that what I saw, I had not seen anywhere else. And I was trying to be honest about the fact that there's a problem that people have to come to grips with and deal with, or else people in the community will die. And that's not something to get somehow shunted aside. I understand the power of words, obviously, but I'm not going to let that power, that concern about words overcome the value of human life. We're here to protect human beings, and people were put in danger last night. Members of the Jewish community were putting each other in danger. They were putting our police officers in danger. Now, if I see it in any other community, I'll call that out equally. So again, if in my passion and in my emotion I said something that in any way was hurtful, I'm sorry about that. That was not my intention. But I also want to be clear, I have no regrets about calling out this danger and saying we're going to deal with it very, very aggressively. Commissioner, do you want to speak to the crossing guard issue?
Sure, and if I may, I mean, just to echo the mayor's comments on last night, there were thousands of people crammed onto one block. And when you look at everything that we are going through as a city, we live in an imperfect world. And we, you know, my department, certainly, I have seen instances of not social distancing. But I could tell you, Marcia, that you, as you know, there was 2 funerals last weekend for members of the NYPD. We would normally have probably tens of thousands of people at that funeral. We had a handful. People have to be accountable for their own actions, regardless of what neighborhood, ethnicity, where they come from. We cannot have what we had last night. We will not tolerate it. We are going to break it up immediately. And really, you cannot even go to that event. That's what it comes down to. Regarding the crossing guards, you know, we've been hit hard throughout the department. We have really positive news. We still are praying for a number of members that are in the hospitals, but we're on the road back, thank God, in terms of our sick rates. One of the things that we are still watching closely is who is at work, who is essential, across many titles. And when we look at crossing guards, I think it's well known. You tend to have people that are a little bit older. So we are very cautious of how we use those crossing guards, in what capacity, and people in terms of their age, prior medical conditions, and the situations we put them in. Of course, we're looking at any and all employees of the NYPD, how to get the most out of what we use. We've worked with other city agencies in terms of lending some of our expertise to other city agencies, and we would not be against continuing to do that. But we're also going to do it in a smart manner that really watches out for everyone's safety.
Next, we have Katie from the Wall Street Journal.
Hey, good morning, everyone. I wanted to follow up with the questions of many of my colleagues. The one thing I can get some clarity from the commissioner on is, you know, the NYPD's involvement with the organization of last night's funeral. So former city councilman David Greenfield said, I guess, that this was allowed. He tweeted, I guess, some information that, you know, this was organized with the NYPD's approval. I don't know if they knew that, if your department knew there would be so many people who showed up, but questions on that and more details on that. When these summonses were issued, was it after the mayor came and asked for it to be broken up, or did it happen before? And just for the mayor, you know, there have been multiple reports. The governor has cited these reports of funerals, and I even drove by a large funeral once on the BQE a few weeks ago. So why were you so shocked that this was the case? Because it seems to have been a consistent problem.
Now, Katie, I'll start and pass to the commissioner. Again, respectfully, I'm not, you're saying I was shocked this was the case. That's not what I'm saying. I've been talking about this issue previously, that we won't tolerate. I even said we wouldn't tolerate. Again, I really want you guys to take the fact that we constantly are briefing you and respect that we're trying to give you a lot of information and you're all intelligent people. You've heard in great detail telling people they cannot gather from all religious communities in their houses of worship. That's been going on for weeks. Telling people they can't even do services in a living room because that's going to endanger lives. We've been talking about all of these dangers and the fact that we're not going to tolerate them and we are going to enforce. We've talked about funerals before as well. That's why I'm so angry that we have given plenty of warnings, worked with community leaders to ensure they gave the warnings, and they have, by the way, overwhelmingly. Let me make sure this is crystal clear. I've said it many times, but I know there are many in this town who love to create confusion and division, so let me try one more time. I want to thank the Jewish community leadership. I want to thank the rabbinical leadership who have consistently said people should not gather for religious services or anything else because it will endanger their own community. I have seen total unity, and I appreciate that unity. And so it's up to everyone in every community to respect these voices of their city government, of the leaders of their communities. There's been clarity across the board. What is so frustrating to me is after all those messages were so clear that so many people would still choose to gather. I understand that they lost someone very dear and important to them, but this is still a pandemic. People's lives are put in danger when people gather. So what's shocking to me is that after all the warnings, something of this size would happen. And that's where I'm making very clear, unapologetically, that the next gathering will be met by summonses and arrests, period. No more warnings. And that's true in every community. Equal opportunity in New York City. If you gather, I'm not talking again about a few friends hang out in the corner. I'm saying if you have a large gathering, hundreds of people, thousands of people, they're not even going to have a discussion. It's just we're going immediately to summons, and if we have to use arrest, we'll use arrest. Go ahead, Commissioner.
Yeah, Katie, and I think I touched on it before. We've been in constant contact with leaders of different communities throughout New York City, of different faiths. Just last week, I could tell you, members of the Muslim community, members of the Jewish community. I spoke to the Cardinal just this week. This is what we do. And in terms of social distancing, probably not a day goes by that myself and the mayor don't talk about, whether it's social distancing in parks, whether it's the sick rate of our employees, whether it's testing that came up earlier today, mental health yesterday, and certainly funerals and religious events comes up. I don't know of anyone in New York City that doesn't know what's going on 2 months into this. I think from the mayor's executive orders, from the governor's executive orders, from watching the news every night, everyone knows what is acceptable and what is not. And conversations between members of the NYPD and leaders who, by the way, members of the Jewish community, extremely helpful in navigating circumstances with this over the last 2 months, because there have been a couple incidents. But planning for what shouldn't happen is in no way having a conversation regarding, you should not equate that with having a conversation regarding condoning a particular event. That event last night never should have happened. It better not happen again. It can't. It is, again, we can talk about this till the cows come home. It doesn't get any crystal clearer than this for me. You are putting my cops' lives at risk, and it's unacceptable.
Next, we have Julia from the Post.
Hi, good morning to everyone. I have two questions, one for you, Mr. Mayor, and one for Ms. McCray. For you, you addressed the homeless and the shelters, but I'm wondering if you could talk a little bit more about your plan for the homeless in the subways. I see that the MTA worked with the NYPD last night to get some people off the trains, but it seems unsustainable to do that night after night. So what's the long-term plan? And then for Ms. McCray, I'm wondering if she can just list her specific credentials for co-chairing the Racial Inequity Task Force. and the mental health program for frontline workers, given that critics, including Councilman Reynoso, has called the first appointment cronyism and nepotism?
Well, let me speak to the homeless issue, and then I'd like to preface on the question of the commission, since I'm the person who decided how to approach that internal task force, I should say. And I'll certainly turn to Shirlane then. On the homeless, I had a conversation yesterday with Sarah Feinberg of the MTA to emphasize that we are ready immediately to implement a plan in those 10 terminus stations that I talked to you about in detail yesterday. And this is something Commissioner Shea and Commissioner Banks and others, we all gathered together to discuss and have real faith this would be a game changer. But to be a game changer, we have to disrupt business as usual, which means we have to close those stations in the late night hours, 12 midnight to 5 a.m., replace the service with a shuttle bus for anyone who needs to get on that line outbound, and they'll still be able to use it just like you use a shuttle bus when there's maintenance or anything else. So it won't disrupt service for people who need service, but it'll allow for deep cleaning of the stations, and will allow for the NYPD and our outreach workers to engage people in a much more effective manner. And it will change the pattern that, Julia, has existed for decades in this city, where a homeless individual could ride a subway line back and forth and back and forth. And that's something that's just not right. We need to address that. What we are seeing here is a real problem, but it's not because something fundamentally changed compared to all the previous decades. It's that there are very few people riding the subways. There's much less service. And so the homeless individuals who have been there all along are obviously standing out more, but it's also a clarion call to help them, to do more to get them out of the subways, off the streets, into long-term shelter, into affordable housing. And I feel for all the riders who are distressed. It's painful to watch, it's unpleasant to watch, it's unsettling to watch. We don't want anyone to go through it. But this city's been dealing with this issue for decades. We've got to do things differently. That's why we came up with the Journey Home approach. That's why we came up with Homestat, and these things are working. But this is a new approach. NYPD feels strongly this is the X factor to end that habit of an individual just being able to stay on that train, or maybe only get off briefly and get right back on and go the whole other way on the line. We're kidding ourselves if we think we can get a different result by doing the same thing over and over again for years and years and years. So I talked to Sarah Feinberg. I said, we're ready to do this. We're ready to cover the cost. All we need is the NPA's support. We had a good conversation. We're waiting for an answer, and we could get going immediately. And in terms of sustainability, this is a sustainable plan for sure. The Homestat initiative has brought thousands of homeless folks off the street permanently. The Journey Home initiative will transform the reality of homelessness on the streets of the city. I don't have a doubt in my mind. And if we can get the support of the MTA, we'll put in all the people power. We'll pay the cost to get homeless folks out of the subway in a whole new way. It won't be perfect, but it will be a game changer. It's absolutely sustainable, but we need the MTA to say yes. So please ask the MTA today if they will support this plan, allow us to pay for it and get going with it so we can really change the reality for not only the homeless, but for all the strap hangers who suffer with this problem. To the question of the internal task force on equity and inclusion. We have a disparity crisis in the city. We had it before. It's been made sharper and in some ways even worse by this disease. My goal with the internal task force, which came out of a variety of conversations among members of this administration, was to ensure that all city agencies maximally address disparity. There's been great work over the last 6 years. There's more that can and should be done. To ensure that happens, it was crucial to make sure that the leaders of this task force would be the people who had the strongest understanding of the issue, the greatest vision about how to address the problem, and carried the weight to ensure that all city agencies would follow through on the work of the task force. Your idea, with all due respect, Julia, of what is a qualification, well, you have the right to your opinion. I'll tell you what a qualification is. A qualification, in my view, is who has the weight and the gravitas, who has the intellect, who has the vision, who has the standing in this administration, because this is an internal task force. Well, this whole administration was created, and we talked about it long before you happened to be a reporter here, the way we did our transition, the way we chose our team, the way we've continued to build our team. The person who's been the architect with me has been our First Lady. And I've said many times, she's my closest advisor and my partner in everything I do. So who better to co-chair an internal task force to make sure that the government is addressing these issues than her? Deputy Mayor Thompson has devoted his entire life to issues of inclusion and equity. And I also am announcing that we're adding a third co-chair, Deputy Mayor Raul Perea Hense, who brings a wealth of experience and obviously has expertise in some of the issues and agencies reporting to him in some of the areas where there's been greatest concern about disparity. But I'll turn to Shirlane and forgive my long intro by saying I know who will get the job done, and she will get the job done. Shirlane.
Julia, I would remind you that the primary task of this body is to listen, to gather information, and to make recommendations. It is not a decision-making body. It is a position that requires the ability to listen well, to convene, and be able to gather information. I'm a volunteer. I'm certainly well placed within this administration to take on this work. And I have a very committed approach to this work. I've been a mental health champion from the beginning of this administration, and I have been praised by leaders of national organizations around the country. I think that if you want to know more about my qualifications, that you should talk to my team, and we will let you know all of the things that I have done that would merit such a position and more. Thank you.
Thank you.
Next, we have Anna from the Daily News.
Hi, Mr. Mayor. Two questions. One, given the budgetary issues that the city is facing, are you guys going to move forward with the BQX project? And also, I'm just curious if the First Lady is going to have to give you a haircut at some point. You're looking a little, your hair's looking a little long these days. So I'm just curious if that's in your future.
I want to give Anna credit. We knew this day would come where a journalist would ask the question. Yes, this has been a topic at home, and Shirlane is a long, Anna, you may have seen some of my pictures from my younger years when I first met Shirlane, and my hair was at least as long as this, and so she's a fan of the longer hair, but yes, it's getting a little much. So we're gonna have to figure out a new approach to hair management. The longer hairs day, I think, is coming to an end. But on the question, very good and important question about the budget, something like the BQX, which had just begun a whole phase of environmental impact review, it's going to be looked at now with all the other major capital initiatives. We talked yesterday about some things that have been absolutely essential, like the affordable housing program, which is being, some pieces of it are being delayed because of the reality of this crisis and our budget reality. So we're certainly going to look at the BQX and make decisions thinking about those same realities. I don't want to give you a firm answer today. It will be discussed in the budget process and be part of what we say around the budget in June. But it's a very good example of the kind of thing that now has to be thought of very differently, simply for the budget ramifications alone. Now, that was going to be obviously an initiative that could only work with a very substantial federal funding. But to the extent there was any city exposure, it has to be considered now as part of our budget process.
Next, we have Steve from Westwood One News.
Yeah. Hi, Mr. Mayor. Thanks again for taking our questions every day and giving us ample opportunity to get responses from you. We really appreciate this. Quick question about a major recreation space in southern Brooklyn. The Gateway National Recreation Area has been a really important release valve for people in Brooklyn and Queens who want to get outside, who want to be out there recreating with their families while maintaining significant social distancing and not having to worry about being close to others. But the MTA has decided to park idle buses because they're using fewer buses at the Floyd Bennett Field facility. And as a result, the entire facility, which had been used for weeks now for safe recreation, is now closed to the public. It's also cut off 400 people from their community gardens at a time when many New Yorkers are having trouble putting food on their tables. And those 400 people rely on the food that they're growing in those community gardens to feed themselves. I'm just wondering, it seems like the MTA and the Parks Department reached this agreement without knowledge of City Hall. I'm wondering if that's the case, and if there's anything being done to try to find an alternative, such as the Reese Beach parking lot, which is completely unused right now, or any other facilities to park these buses. And then one other question about the beaches. Considering that we have people social distancing in...
Steve, you there? Steve? Well, we got part one, I guess. If we can get him back, we can do the second part. I'll start answering, and you'll let me know if you bring him back. Steve, thank you for your comment in the beginning. I want to say, I think for everyone, is Steve back or not? I'm hearing some feedback there. You good? Steve?
Yeah.
Okay, there you go. We heard you start to talk about beaches and then lost you. I think we're losing.
As a second question. The beach issue was just, it seems like social distancing as it's maintained in Central Park and Prospect Park could also be maintained on many of our 14 miles of city beaches over the summer. Some of them may perhaps not. I'm wondering if that's being considered for approved recreation over the summer.
Yeah. Okay, so Steve, thank you for the questions. And I want to say thank you for your kind comment about what I've tried to do, my team's tried to do here, which is to constantly make information available and take questions from all of you that would help the people in New York City get a better sense of what's going on, and obviously, answer important and tough questions that the public deserves answers to. So thank you. I want to thank everyone in the media, because this has been, an extraordinary situation where we're doing this so often. And I think the people of the city have appreciated that this dialogue happens so regularly. So thank you to all. To your two questions. So I'm not happy with what I'm hearing about Floyd Bennett Field. It doesn't make sense to me. Steve, what I don't understand is exactly who all the parties to this were. Obviously the MTA. My understanding is that situation is controlled, that space is controlled by the United States Park Service. I don't know enough about what city agencies' involvement was or wasn't. I'll get down to the bottom of that today, and we can give you more of an answer later. But I can tell you I don't like what I'm seeing for the very reasons you outlined, that we want people to have access to recreation for just the amount of time they need each day, and obviously with social distancing, but people do need access to that recreation. People do need access to community gardens, again, following those rules. And I don't understand, it's not anything negative to the MTA, I just don't understand why, with so much less service going on, it would be necessary to knock out, those opportunities for everyday people. And, I have to believe there are other alternatives. So we're happy to work with the MTA on other alternatives, but we'll come back to you today on that. On the beaches, I think we're starting with the notion that, first of all, we don't know what the next few months bring. The normal time we would have opened the beaches would have been a matter of weeks from now on Memorial Day. That was inconceivable from everything that we have been experiencing. Because remember, how do most people get to the beaches? They get on the subways, they get in buses, they drive their cars, and then a bunch of people congregate. That was not something we could possibly imagine for the near term. we are still fighting day to day to beat back this disease. You've been watching the indicators, Steve. We're making progress, but we're still not to the kind of progress we need. So that's where we knew we could not start the beach season anywhere near like normal. As I've said, we're open to later on in the summer, we may get an opportunity. I think your point is well taken. If we get to something, we get to a point where we could start to open up, how would we do it and how would we do it smartly? I think it's fair to say I could see a scenario where we would do social distancing and limits on the number of people. But I also want to urge people to recognize that won't be easy. That's a lot to enforce. Comes with real problems and potential dangers. So that one would be a high bar from my point of view. We'd have to be really certain we were turning the corner on the disease, really certain we could do it the right way, and that we could enforce it properly. But it's a perfectly fair idea and something we're going to look at as one of the options. But that's not happening overnight. That's something that would be down the road when we've had a lot more progress beating back this disease.
Next, we have Christina from Chalkbeat.
Hi, Mayor. Thanks for taking my question. There's obviously and rightfully a lot of focus on mental health right now. I'm just wondering if we can expect a specific plan for teachers and students who are also dealing with a lot right now with the shift to remote learning.
Yeah, Christina, absolutely yes. The chancellor mentioned this originally a couple weeks ago. And I tried to amplify yesterday how much we're focused and concerned about the mental health needs of our kids. I've spoken with the First Lady about it. The First Lady and the Chancellor are working together to take a lot of the initiatives that have been created through Thrive and apply them in the coming months with our kids remotely, but also to start the planning for September. And we understand that September there's going to be a challenge in terms of mental health for our kids that's absolutely unprecedented. And we're going to have to do a lot in every school to support kids who have honestly been traumatized. So you're going to, in the not too distant future, hear the specific plans to address mental health needs of kids over the next few months. And then as we get closer to the opening of school, definitely a plan is going to be put out on mental health services in all schools for September, and the First Lady and the Chancellor will be working on that together, and the First Lady is going to add.
Yes, you should know that the mental health services that are provided to our young people are continuing, that teachers are being trained in social emotional learning, which of course deals with the children's emotional needs, so that they are able to continue working with children online to a certain extent. In the fall, we hope to have a more expanded program because we know that so many of our young people are going to come back in distress. But we haven't stopped doing anything that we're already doing. We're doing what we can virtually, training the teachers, bringing up to speed so that they will be ready in September.
All right, thank you.
Next, we have Melissa from News 4.
Melissa? I don't know if we have Melissa. Are you there, Melissa?
Hi, Mr. Mayor. How you doing?
How you doing?
Sorry, I was checking on my daughter in school.
That's important. You had your priorities right.
Walked away at the wrong moment. So thank you. We've been reporting that a few children hospitalized here in the city appear to be experiencing some of the same inflammatory symptoms that British officials warned about over last weekend. Some of the children have tested positive for COVID-19 while others have tested negative. But we're wondering what you're seeing big picture. Your health department says since the inflammatory symptoms are not required to be reported to city health officials, they can't say exactly how many children are experiencing these serious side effects right now. Is this something you want your health department to be tracking? And what else do you know about this, if anything?
Thank you for the question. Look, I'm concerned because, you know, Melissa, we've talked about from the beginning, we're dealing with the great unknown here. And I think we have to be vigilant all the time to any new development that might give us a warning of something bigger. Because obviously the entire mission here is to save lives. and particularly precious is saving the lives of our kids. So I'm concerned about it. I don't pretend to have expertise on the exact reality, but I'm very concerned, and I think we've got to figure out how to understand it better, and if it is something to be tracked. Let me turn to Dr. Barbeau, and I know we have Dr. Eric Way, who's the Vice President of Health and Hospitals. I want to see if either of them would like to speak to this issue.
So, Mr. Mayor, I will say that I'll start with what we've been saying for a while. Every day we learn more and more about how this virus behaves, both from a public health point of view as well as from a clinical point of view. And, recently we have been talking about the way in which coronavirus can affect the heart and the cardiovascular system. To date, we have not heard of ways in which the coronavirus has been affecting children's cardiovascular system. We do have regular ongoing calls with infectious disease specialists throughout the city. We have webinars with them. Additionally, we meet on a regular basis through webinar with doctors, leaders in the intensive care units of all of the hospitals, and we have not seen this to date. I've also been in communication with our medical examiner. She has not noticed this in cases that she has seen, but we are in contact with our academic partners to ensure that if this is a trend that's being seen through our clinical partners, that we work collaboratively to understand it better. We are always paying attention to what seems to be emerging, not only from the worldwide literature, but also what we're experiencing here in New York City.
Dr. Way, anything you'd like to add?
Thank you, Mr. Mayor. So similar to Dr. Barbeau, I am not aware of this being a trend in New York City health and hospitals. I think that was one of the things that we were most kind of, appreciative of, and being a father of two toddlers, 3 and 5, and a baby who's 7 months old. Being scared for our children. This virus seems to not affect our young patients nearly as much as the older and those with comorbidities. But as Dr. Barbeau mentioned, we are paying attention through our pediatrics council, our critical care councils, our emergency department councils, and we are not seeing a lot of children testing positive for COVID or getting very ill, ending up in our pediatric ICUs from COVID. But we are aware of the news and the literature that's ever changing out there about inflammatory changes, Kawasaki disease, and we're paying very close attention to that, and also listening to our science and our experts.
Last two for today. Next is Matt Chase from Newsday.
Hey, thanks for taking my question. I appreciate it. For the police commissioner, regarding gatherings, what exactly will you be doing differently going forward from what you did last night? How will your summons and arrest policy be different from what you did last night? And to what extent is the procedure changed for handling arrestees and folks getting summonses physically since the coronavirus? And for Dr. Barbeau, can you explain in epidemiology the difference between absence of evidence and evidence of absence?
Okay. Dr. Barbeau, why don't you take that first, since that sounds like a question I would certainly not have the answer to. So why don't you take that one, and then we'll turn to the commissioner.
That's a really good question. And when we say that there is absence of evidence, it means that there are not a good amount of studies that have documented evidence one way or another, what the particular finding in question or the particular question in question may be. So that's an absence of findings. And then the other part of your question, if you could restate it.
Do we have Matt still there?
Sure. Can you hear me okay?
Yeah.
Yeah, I was wondering if you can explain evidence of absence.
Evidence of absence, meaning that scientific studies were done, clinical studies were done, observations, et cetera, and confirmed that there is no current association with the particular question in mind. Now, that's not to say that future studies may not find a finding, but that's what that means.
Okay, Commissioner Shea.
So what I'll say about the gatherings, we're 2 months into this pandemic at this point. And when you look at how we as a police department have policed, I am biased, but I think we've done a good job of balancing and using discretion and working with New Yorkers from one end of the city to another, in terms of whether it's in parks, whether it's at religious gatherings, whether it's outside housing developments, or whether it's on the street, lining up to buy groceries. I think we've gone into it with an appreciation of this is tough for everyone, and we got to get through this together. And we've empowered our officers for years now to use discretion. And I think that has come through in this. By and large, you've seen New Yorkers cooperate. You've seen incidents pop up. Certainly, we've had an increase in 311 calls. I view that as a good thing, that people are letting us know what's going on and taking interest in their city, and it is their city. Overall, we've seen really few, when you think of the tens and hundreds of thousands at this point, interactions across this city in a variety of circumstances. Arrests are the far extreme. There have been some summonses, really not a lot, and usually it's been a mutual cooperation. But here's the only thing that's changed. We are beyond, at this point, asking people to comply. We cannot have, for the third time, what we had last night. And that is irrespective of any religion, any race, any part of this city. It is simply putting you at risk. It is putting your families at risk. It is putting the critical workers at risk that are already risking their lives, saying goodbye to their children, and going into the unknown in emergency rooms across this city every day. And it certainly, for the last time, is putting my cops at risk. And what you should take away from that is how really unnecessary it is. We grieved this weekend for 2 fallen detectives, but we did not come out. We did it from our home, by and large. And there is no reason that anyone in this city cannot do the same in this unprecedented time.
Last question for today, Deborah Lee from Manhattan Times and Bronx Free Press.
Hey, good morning, everyone.
Good morning.
I wanted to follow up on the conversation that's being had around testing and how the capacity for it continues to ramp up, both on the city and the state level, to the extent that we're talking about expanding testing at NYCHA sites, at independent pharmacies, and the like. In doing so, can you speak to whether, in fact, the guidance on residents seeking out testing has changed? Has more testing, in fact, then led to a conversation about inviting residents in the effort to both test and trace and identify the illness, and that as it continues to progress? In fact, are we saying to residents, are we changing the guidance and saying, if you're asymptomatic, potentially, you should still seek out testing to be certain? And then in light of that, are we looking at a prelude, essentially, to what's already happened in Chile, and we've heard Dr. Fauci discuss, which are, essentially coronavirus certification or some kind of identification that speaks to whether you've tested positive and what that will mean? And then finally, when we talk about this testing and tracing policy, what concerns does the city have about how this will affect undocumented immigrants who are already concerned about, the big brother quality of some of these programs, and in fact, the disincentives to come out and get tested because there is this follow-through in a way that potentially might be invasive and they would worry might well lead to dire consequences?
Yeah. So, Deborah Lee, appreciate it. Let me work through these questions quickly, and our medical colleagues might want to jump in as well. But let me take the first stab. For the undocumented folks, look, this is a city that has gone out of its way to show absolute and total respect for all human beings who live here, regardless of documentation status. I think that's something that's deeply understood in immigrant communities, that we do not ask documentation status when we provide services, especially things like healthcare. NYPD does not ask documentation status. We go out of our way to make sure that records are not kept that would be problematic. People have been told who are undocumented in this crisis, you know, we want to make sure you get food and you get medical care just like everybody else. So, and obviously the initiative that we created with the Open Society Foundations to provide direct support to undocumented folks who don't have a livelihood is exceptional, and says the level of commitment the city has to all human beings. So my hope is, when it comes to something as important as knowing if you have a disease that obviously can be life-threatening to you and your family, that is more important than anything else. Folks who have come here overwhelmingly to try and better the lives of their families, often from very, very difficult and even tragic situations where they came from. So I would like to believe that, notwithstanding the fears, there would be, the first impulse is, if someone needed testing, they would get testing and know that it would be kept confidential by the City of New York, because we keep everything confidential. In terms of your larger questions, has the guidance changed? In a sense, yes, but in another way, I wouldn't say all the way. It's changed in the sense that we once had almost no testing in this city. And then we had to try to use the little bit we had to focus on the sickest patients and the healthcare personnel and the first responders. And now we're able, only in the last few weeks, to open it up to broader communities. So that's definitely a change. Our message to people is that getting tested is important, particularly if you are most vulnerable, older, and or have pre-existing conditions. So that's been consistent. But what will change for sure, much more deeply in the next few weeks, is when we go to a huge test and trace approach. Then we're saying to tens of thousands, ultimately hundreds of thousands of New Yorkers, we want to maximize testing. And then we want to test anyone that, if you test positive, we want to test the people that you had close contact with. So the guidance is changing, but it's going to change a lot more. I think on the question of certificates, that's something we have to think about for the future. It has been used as a tool in one way or another. A certificate or something that's an online registry has been used in different places. I think it's certainly a commendable idea, but we have not made any conclusions on that. Would have to be done in a smart way. There's a lot of things we'd have to think about legally, privacy, other issues. But it's certainly on the table as something we're looking at, how you support a really broad gauge testing system and how you get us back to normal with the information that testing system provides. So those are some answers. Doctors, anything you want to add?
Yes, Mr. Mayor. I will add that it's important to tease apart the two tests that we're talking about, because I think all too often antibody tests get lumped in with testing for the actual infection. And so it's important for us, A, to tease that apart. With regards to testing for infection, the guidance remain in terms of wanting to make sure that individuals who have chronic underlying illnesses that put them at greater risk for bad outcomes are prioritized for testing. But then as the availability for testing increases, we want to then test more individuals. In addition to that, we are doing everything we can to maximize the number of ways in which we increase access to testing. And so recently we announced that we are moving forward H&H, and then we, through the Public Health Lab, will also do nasal swabs instead of nasopharyngeal swabs, putting less of a strain on PPE. So that's how that testing arm has evolved. When we talk about testing for antibodies, we have to be very clear that there is no science that tells us that there is durable protection or immunity if someone tests positive for those antibodies. And so we want to be very careful not to give false hope for people, because there's no correlation with immunity. And in fact, there have been some preliminary studies that indicate that people can be potentially reinfected with COVID-19 in the same season. And so we're waiting for more studies to be done to tell us whether those findings are corroborated or not. I think where antibodies may be helpful for us in the future is to give us a better understanding in the next season. If people who have antibodies for this season get reinfected next season, then we'll have a better understanding of what those antibodies really mean and whether or not they are protective. And if they are protective, how long they last.
Dr. Way, anything you'd like to add?
Thanks, Mr. Mayor. Yeah, and I would just reinforce what Dr. Barbeau said. The antibody tests, I think there's benefits even to our healthcare workers in terms of the psychological safety of knowing that I've been exposed and I wasn't one of the ones who ended up on a ventilator in the ICU. But we don't know how much immunity, and so we don't want people to relax their social distancing or their PPE usage. And then on the undocumented immigrants comment, I mean, that really resonates with health and hospitals, with the mayor's administration. It is part of our ethos. It is in our mission statement. The two most important words are without exception. We want to help New Yorkers live their healthiest lives without exception. We don't ask. I, as a doctor, don't care about your immigration status. I care about your health. And if that health is at risk because of COVID-19, I want you to get a test, and I want to provide you the appropriate treatments and results. And so I don't want anyone to think that at health and hospitals we will be asking immigration status, because we don't. We care about your health.
Nicely said, Doctor. Thank you. And let me conclude by us going back to where we started, the extraordinary work, the heroic work so many healthcare workers have done, so many first responders have done over these weeks. Unprecedented, unimaginable what so many have gone through and that no one could have foreseen, and yet the heroism has been so clear and so sharp. I want to thank the First Lady. I want to thank our police commissioner. The idea that we will all support our healthcare workers and our first responders in every way is a good example. When they say that phrase, we'll leave no stone unturned, that's what we're talking about when it comes to supporting the heroes of this fight. There's a lot they need. There's a lot we have to give to them to support them. And everyone recognize, every time you say thank you to one of these heroes, every time you offer to help them in ways big and small, all those wonderful people have come out to applaud at 7 o'clock at night. All the people who have brought food and support to hospitals and to our EMTs and paramedics and all of our first responders. Every bit of it helps. And we're going to be there for them because they have certainly been there for all of us. Thank you, everybody.